Thanks for staying with us. You may or may not know this, but September is National Suicide Prevention Month, and today we have licensed pastoral counselor Dr. James Stillwell with us to help us more effectively talk about the epidemic and how we can help others avoid death by suicide. It's a very, very serious topic. Thank you so much for being here, Dr. Stillwell.
Thank you for the opportunity.
We talked numbers a little bit in the tease, but it's so prevalent in our society. What is it, ranked number 2 right now?
Something like that. And it's, as you and I were talking earlier, it's more prevalent than we know. Because a lot of times coroners don't talk about it for the sake of the family, and the media doesn't necessarily talk about it. So it is a bigger problem than any of us realize.
Sure, and I'll say that going on in the media before we actually go to talk about this. It's our policy not to discuss suicides in the news unless it's somebody famous or unless it was something that was so outlandish or so surprising, I hate to say the word outlandish, that we have to cover it, that a lot of people saw
and
it
I
or
do
something
think
like
this
that.
is the first thing we wanted to talk about is how to talk about it.
Right.
And especially in the media. And so one thing that I recommend is to not use the word committed, because that it adds to the stigma. It makes it harder for people to come forth and say, here's what I'm struggling with, if you're about to commit some crime or something. And so anyway, that's one part of it. And just to say death by suicide. And to say it that way also because there's so many people out there, especially when there is a famous person, who do the copycat thing. So talking about the means of death causes some copycat deaths to happen. So we want to avoid that.
So how do we? I mean, oftentimes people say they're so upset they're going to kill themselves, or they say they're going to do this, and we don't take it seriously.
Yes. So rule number 1 is always take it seriously. And ask the person directly. You know, oftentimes we want to soften it and make it easier and say, what do you want to do, self-harm or anything? And that's not a bad question, but are you thinking about suicide? Are you having suicidal thoughts? Is more direct, and it causes the person to say yes or no. And if it's yes, then you can follow up with that. Part of the deal is freaking out doesn't help anybody. And giving the person who's struggling some sort of ultimatum or anything like that is counterproductive. You really want to make a collaborative approach of being alongside somebody and saying, let's talk about this together. What can we do together that will help?
Let me ask you this. I know May is Mental Health Awareness Month. Do you think there's like a direct correlation between depression and suicide?
Of course. Probably about half of what we're talking about today is directly related to mental health issues. The other half of it is just related to the means to self-harm and suicide are way too accessible. And one of the first things I'm going to do if I'm working with someone, and this is very clear on the military sites for suicide prevention, is make sure that they get in contact with the people in their lives, and if there's a gun, that gun is locked up, the ammunition is taken away. There are ways to do that are very preventative and very helpful. And same with medicines and things like that. So whatever the means is, we want to, as much as possible, with that person's active participation, to take the means away.
Dr. Stillwell, I mean, we could go on and on. I'd love to go so in depth in this. It's affected both of our lives in very personal ways. If we know somebody that is feeling suicidal, or if we are feeling suicidal, how do we get help?
Okay. Well, we're very fortunate in the state of Kentucky that every licensed counselor has to have several hours of suicide training and has to get that revised every few years. And so get them to a qualified professional, someone who has a good reputation, and let them talk that through.
And how do we get a hold of you?
So drjamesstillwell.com gives all my contact information, and I think you've got the suicide prevention hotline
we
up
have that
as
number
well.
up there as well. Thank you so much for being here and
My
talking
pleasure.
about this. Definitely get help if you feel like this is an issue, because it obviously is more prevalent than any of us think. Stay with us. We'll be right back.